So, very good afternoon to everybody on behalf of the panel. Make in India, and the way I actually want to start Make in India is not talk about Make in India, but to understand as to what happened to the country about 18 months back, that in every forum today, there isn't a conference that happens in this country without Make in India being a subject. And there's something dramatic that has happened, the government has been able to do. Because 18 months back, you go to any conference, Make in India was never spoken about. It wasn't as passionately as we talk about Make in India today that we've ever spoken about Make in India in this country. I would honestly, I stand convinced that the government has been able to do a tremendous job by launching the campaign and has built a great excitement in this country around Make in India. Have we done much around it? I'm not too sure. But are we talking about it? Yes, indeed. And I heard somebody saying this yesterday, that if we're able to converge what we speak, even to the extent of 10%, we would have got Make in India right in this country. So when Make in India was actually announced, one of the agendas of the government was to have, so our current contribution of manufacturing in India to the GDP is about 17%, which was the figure last year. The intent of the government probably is to get it to 25% in the year 22, which is to say a big thing if you're able to make this happen. The campaign framework focuses on 25 key sectors that will put India on the global manufacturing map, facilitate the inflow of new technology and capital, while contributing to a significant job creation, and that's a big one for India. And the number we're talking about is 100 million jobs, which is almost 10% of the population of this country. Now, Make in India is a partial realized or partial reality for the med tech industry as well. I'm going to talk about med tech industry so that you're familiar with the numbers that we'll allude to during the course of our conversation. So India, from a healthcare standpoint, is about 100 billion, close to $100 billion market. To be precise, it's difficult to be precise in India because somebody will come up with a number which is a contradiction. But $92 billion is what the stated number looks like for the year 2014. And of that, approximately $5 billion is on account of medical technology or med devices. Now, $5 billion is not a large number when we look at it from a global comparison, comparing ourselves to China, because the populations are almost similar. This number, if you were to take a conservative estimate, is set to grow to $30 billion. So the $5 billion today will actually grow to $30 billion by 2025. Now that's a big number. But the other thing that you must know, of this $5 billion, 70% is import. Right? So the medical devices which are used in every procedure, almost every procedure in this country, 70% of them is import. Now if that number stays static, that means on a $30 billion, we'd be importing 70% of that, which is about $21 billion. Now that has to get corrected, which is why Make in India is extremely important. Now we have some potential learnings from other countries. We have all spoken about China. I'm going to leave you with another country, which is Ireland, to think about. I won't allude much around what Ireland did, but they provided tax incentives for setting up manufacturing in their country. They provided an environment where IP was taken care of. So I think we'll have to do something similar to be able to make in India. The other piece that I'm going to allude to is that the med tech, so it's not the responsibility only of the med tech here in India to talk about Make in India. The med tech, the healthcare delivery, and the entire ecosystem at large needs to constructively engage in a dialogue to facilitate Make in India. Now, what can Make in India do to us? It can actually bring down the cost of goods. It can enhance the quality. And more importantly, it can create more relevant products to the country. When we start to import, we are importing what is made for the rest of the world. India is a little different. We are a more fragmented market. And I was hearing Vishal yesterday in his session. He spoke about the ideal size for an Indian hospital. And the sweet spot that he alluded to was 200 beds. And by the way, when we talk about 200 beds as a hospital, globally, it's very different. China talks about 3,000 plus beds about their healthcare delivery systems. So if you're able to bring down the cost, get a better quality, have more relevant products, this will actually enhance the affordability and access of healthcare in our country. So what you see today, and I'm sure when you look at the varied expressions that we're going to have from this panel, and this panel is not the MedTech panel. This panel is a configuration of people who come in from technology companies in the social media space to innovators. Today I'm going to talk about all of them a little while later. So our panelists will ensure a meaningful discussion on leveraging Make in India. So there are some questions that I'm going to leave the panelists with, which we'll try and answer during the course of today. How can India raise its global competitiveness? How can India enhance its global recognition for acceptability of its brands? Can we just make in India or create in India for India? And I'm going to use this term time and over again, make and create. There's a little differential in my mind. And we'll have one of our panelists actually talk about it as well. How can we activate the call to action for Make in India? And most importantly, are we ready with skill sets to propel the Make in India campaign? Today, through the Make in India session and its relevance to healthcare, we'll aim at understanding the context, constraints, and opportunities for the medical device industry, healthcare providers, key policy makers, exploring the relevance of India vis-a-vis other global manufacturing destinations, and alignment of Make in India with other key government initiatives. So let's get started. And I'd actually want to begin with Nishant Rao, a dear friend and country manager for LinkedIn in India, on the extreme left of our panel today. So a little bit about Nishant before we get started on with our question answers with him. So he's one of the most happening business leaders under the age of 40, as reported by Economic Times this year. So can we kind of give him a big round of applause to start with for his achievements. Nishant has held multitude of leadership positions at McKinsey, Ariba, Epicenter, Microsoft prior to the current role. So Nishant, sorry? Okay. So we have the Joint Secretary just walking in, and Shobha tells me that Mr. Chaturvedi will be here in a while from now. Nishant, as I understand, LinkedIn has about 31 million users in this country. And I just got updated today morning. This is the second largest market. So India is the second largest market for LinkedIn in the world. And US being the largest market, which Nishant will of course talk about. So Nishant, what does your data show? Has the influencer community increased with the Make in India campaign? Has it created job creation or more of global recognition for India? So kind of over to you. It's a broad canvas. You may want to take it the way you are.
Got it. Is this on? Great. So Varna, maybe share some thoughts and then come back to exactly this question in Q&A. It's great to be here. Good afternoon, everyone. And I'd like to thank the FICCI leadership as well as my friend Varun for enabling this session where I could share my thoughts with you. When I thought about the theme of Make in India, I went back to sort of the Prime Minister's speech, right? And he talked about 3 Ds that really were the underpinning of Make in India: demographic dividend, digital, and democracy. Now, I'm the outsider in this panel. I'm the one who's not sort of core in healthcare. So I'm going to let the experts here talk about the growth that we have seen over the last couple of years in each of these. But I decided that I wanted to play the challenger role today on this panel a little. And so for each one of these, I wanted to share a startling fact, at least for me, it was news, and maybe offer a couple of examples or ideas of how we could actually look at this differently. And then come to, some of them will touch upon how others are doing, leveraging the platform to do this. But if I start with demographic dividend, to me, really, that's about skill development and talent attraction. And so, when I know that there's a skills shortage in the country. I think all of us know it. But I was surprised to see the magnitude from a healthcare standpoint. So there's a survey that, or stats that the Ministry of Health and Family Welfare just put out earlier this year, which talks about a 98% skill gap across many different aspects of healthcare professionals. Whether it's from radiology and imaging to you think about sort of paramedics, or even just something as simple as skilled administrative professionals. Now, another stat that I think I saw someone from Deloitte here, I was reading their report, and they talk about how woefully short we are on core constituents like doctors and nurses. India has 0.7 doctors for every 1,000 and 1.5 nurses. And the WHO average, this is not ideal, but the WHO average is about 2.5 for every 1,000. So we're clearly short, on this skills story. But I wanted to imagine a little bit something different. So we have on one hand a skills shortage, and on another hand we have the graduates that are coming out of these universities. Only 1 in 3 really are getting placed in any meaningful capacity. So on one hand you have a glut of talent, and on another hand you have sort of a shortage of talent. And so to me, I think this is about sort of more informed skill matching. And what I'd like to challenge folks here with is think a little bit outside of the industry. So hypothetical example, what if we had engineers, we have a ton of engineers coming out, and what if we were able to help this engineer figure out that actually they suck at coding, and they're actually not really strong on core sort of programming concepts, but they're actually good at communication, and they have good sort of analytical rigor. So, for a lot of the data that, the healthcare systems are throwing out, maybe actually a career as, a medical technician or a radiologist with, of course, some additional training may be a possible path. How many times are we actually reaching out to these constituents and actually trying to get folks outside the industry into the industry? And I think one of the big trends that I'd love to see happen more, it's starting in India, is around sort of proactive employer branding. So Biocon is an example from the healthcare sector that's actually doing a great job of this, where they're actually showcasing some of the hardcore problems that they're solving and creating sort of passion among people across different industries. And in particular, they're doing a great job of actually sourcing talent internationally and bringing them back using these concepts. So that is one idea I wanted you to think about from a skill development standpoint. Let me switch to digital. Digital to me is the best opportunity we have to deliver at scale. So scale of, in your case, patient education and customer service. And when I thought about, I read a stat that said about 86% of India's healthcare spend is out of pocket. And it made me, for the first time, realize how many millions of, actually billions possibly, of Indians are left out without actual healthcare because they don't have the ability to sort of pay out of pocket. And I'm hopeful, through the budget that we're seeing increases on the government side of spend. But, what was rattling to me, and this is why I was shocked, was seeing some projections also again from Deloitte, which talked about sort of the spend in healthcare IT and telemedicine to be at a whopping 20% growing globally or annually. And when I thought a little bit about that, few folks can think about, hey, this is the young, brash tech executive that's talking about single-digit or double-digit growth, and that's a bad word sort of in the technology industry, but the base at which we're talking about, the spend in India currently on healthcare sort of technology is $7.5 million in the $100 billion industry that Varun talked about. And so for us to grow and be satisfied with the 20% annual CAGR, I think is a missed opportunity. I'd love for us to be dreaming bigger. We have 350 million internet users in India right now, as of June, IMEI stats. We're in the world's second largest smartphone market. Notice I didn't say mobile, I said smartphone market. So these technologies are already there and are available. It just requires us to actually be leveraging them in a much faster fashion and taking some risks associated with that. So I'll give you a couple of examples that come to mind. The first is around assisted automation is what I call it, is how I refer to it. But we're seeing this in e-commerce, where to get past some of the skills shortages that they're facing, they're using technology. So, for example, they have something as simple called put to light, where in a warehouse that's there, for a employee that's there, it just lights up the object that needs to be picked up, and it tells him exactly where to drop it. And logistics is pretty complicated in the e-commerce space, as you can imagine. And so something as simple as that, could we actually apply that to our hospitals and, help people, not necessarily with the full training, to rely less on judgment and rely on technology to be able to say, let's take this blood sample and make sure it gets to the right place. Let's take this report and make sure it gets to the right place. So I think there's opportunities for us to be thinking about this level of sort of automation and assisted automation. Another one is just around awareness that Varun was talking about. I mean, we have literally millions of, tens of millions and hundreds of millions of social media users today, but we're not doing as much as we could to actually spread awareness. So this is an example from the US where GE actually decided to partner with us and they talked a little, they used content marketing because they have all the stats that you can imagine, as do many of you in this room, to do a very targeted sort of awareness campaign where they built sort of stakeholder awareness around certain issues. So they were talking differently to government officials, they were talking differently to talent, they were talking differently to thought leaders. And I think that's an opportunity that I'd love to see happen more here in India. Or, you know, each of us is our leaders here. How much do we actually talk about sort of what we care so passionately about? So, you know, you think about a Kiran Mazumdar-Shaw or a Swati Piramal, they're influencers on the platform that are actually showcasing, you know, from the front and saying, this is the change that we hope to see. And I encourage all of us to be actually leveraging the platforms to get our ideas out there and sort of, you know, communicate in that fashion. The last one here was around democracy. And to me, that was just about leveraging the wisdom of crowds. So, you know, on one hand, I was happy when I saw an India Pharma digital report talked about 95% of healthcare companies in India are on social media. And by the way, LinkedIn is the most used and trusted platform for this. And, you know, I was proud, but it didn't resonate with me because I'm not seeing the healthcare community in India leveraging the platform as I am seeing in other markets or even other traditional industries, including engineering services. And, you know, those guys are using the platform in smarter ways. And so I'd love to challenge us to be thinking a little differently about how we make that happen. And I think fundamentally I've boiled it down to a risk aversion, which is not an Indian trait. It's generally sort of in a regulated industry like healthcare globally as well. And I think there's a fear that if we were to actually communicate and engage people, what would happen? Because we would lose control of the conversation. So I'd like you to imagine maybe reversing that and saying the conversation is actually happening anyway. What's actually meaningfully absent is an informed perspective that all of you in this room actually have. And so, you know, I actually would go to the extent of saying you have an obligation to make sure that this right information, you have tons of data saying this is the right medicine that's going to reach the cases, the right sort of constituency. So we don't have fraud cases happen as we all have seen in the news recently with, you know, fake doctors sort of spreading information. So I'd love for the healthcare experts to actually show up and be talking about, you know, these. So Philips, you know, has a group called Healthcare Innovations in Health, where they've connected a ton of doctors. This is a Europe example, and they're allowing doctors to just collaborate with each other. They're just curating the conversation. They're not necessarily talking about Philips products and so on. Citibank has done something similar with professional women. And I think there's an opportunity in this country to engage as a community and share ideas and just craft a meaningful useful experience. And what happens is not only is the activation that Varun was talking about start actually at a grassroots level where everyone can feel like they have clarity on what needs to be done, maybe apply that. And I think we'll hear from Kanav about how you can actually apply these as entrepreneurs. But you know, you can actually meaningfully, you know, move your own company metrics. So even thinking about it selfishly, for a lot of these that I just talked about, including Philips and Citi, they saw huge brand awareness increases, not just top of funnel, but even bottom of funnel metrics. So that's what's possible if we are sort of willing to take a few more risks. So I'm going to wrap up. I think the challenges that I've talked about across these are not necessarily uniquely Indian. They're really global, maybe to different degrees. And you know what I'd love to see, you know, I started with the challenger mindset, but I'm actually an optimist at heart. And I'd love to see India rise to the occasion because we have the opportunity, believe it or not, to be the talent hub of the world, including a lot of the healthcare shortages that we're talking about are actually acute in international markets. So I think healthcare as an industry has a meaningful part to play in Make in India. And I'm really looking forward to all of you partnering with us and with each other to actually make that possible. Thanks, and I'll answer more questions in Q&A.
You seem to know a lot about the healthcare industry as well, is the perspective that I get now. So excellent talk, Nishant, and I think the reason that we got you here was to get an outside-in perspective, and not many can do as much justice as you've done. So thank you so much for a really challenging conversation in some way or the other. And we'll now have our panelists who come from the healthcare world to kind of try and give you some answers as well. So we have Nandu S. Nandakumar, CEO and co-founder of Perfint Healthcare with us today. Nandu started his career with GE Healthcare and held various responsibilities in supply chain operations, Six Sigma sales, and lastly as the vice president and CFO for GE Healthcare. After GE, Nandu had a brief career outside healthcare as director, process excellence at Cognizant Technology Solutions, and CEO at Ambit Corporate Finance before co-founding Perfint Healthcare. He's been awarded the Indira Innovation Award and Udyog Ratan Award by Institute of Economic Studies, and has been a regular speaker at healthcare, entrepreneurship, and innovation forums across India. So Nandu, do you think Make in India is essentially around manufacturing, and I'm going to allude to the conversation that you and I had a couple of weeks back, where he took the Make in India conversation to a different level. He said, Varun, India is not about making in India or manufacturing in India. We need to start thinking of creating in India, then manufacturing in India, to be able to do justice to the conversation that we have. So I think it's time that the audience hears from you, Nandu.
Thanks, Varun. So good afternoon, everybody. I'm going to give you some perspectives from the imaging industry. As you know, medtech is an ocean, and imaging is a small part of it. My background has been in imaging and in Perfint. It's in image-guided procedures. Prior to this, as Varun was saying, I was with a few of my colleagues who are in the audience today at GE, and thankfully, GE was going through its own global manufacturing and global product company concepts where we designed, manufactured, sourced a whole lot from India. So I'll probably share a little bit. But my background has been in imaging, so I'm going to give you a perspective from the imaging industry. So manufacturing within the imaging industry probably has been since 1970s in India. And GE used to make X-ray systems with Alpro in Pune. Today it's become a 100% entity. Siemens used to be making it in various parts of the country. And several other entrepreneurs that were with these multinational companies started manufacturing X-ray systems in India. And X-ray is the basic imaging equipment. So for long, India has been manufacturing some of the other imaging equipment. Given my background in GE, I'll share a little bit about what GE was doing, or rather is doing, in manufacturing. Apart from manufacturing X-ray systems through its joint venture partner Alpro, in 1995, GE designed the world's first truly portable ultrasound system, which was then sub 10 kg and then considered portable. Today, I think mobile ultrasounds are considered portable. That time, it was the first 10 kg ultrasound system designed anywhere in the world. So GE designed that in India, and we made them and shipped them worldwide. And over a period of time, GE had the confidence, based on the success of this first ultrasound product, to move a whole lot of engineering work to India, R&D work to India. The time that I left GE, it was in 2002, we had about 600 odd engineers designing products for world markets from India. And today, I guess it's grown to about 1,200, 1,500 engineers. Apart from engineering, GE also used to make a lot of products. Ultrasound systems were made here. Cardiology devices were made here. GE had a joint venture with Bharat Electronics to make X-ray tubes, detectors, ultrasound probes, high voltage tanks that go into all the CTs and other X-ray based systems. Is to make patient positioners like the CT tables and MRI tables, and a whole lot of other things were made from the GE factories in India. Other than that, GE also used to source directly from vendors for their global factories in around the world. Right, so that was GE, but though we were very keen on designing in India for India, I think sometime in 1999 we started this initiative to come up with a product that was made in India truly for the Indian market. Very recently, GE announced a CT scanner that was a low-cost, affordable, I would say, which was completely developed in India for the Indian market. So though manufacturing has been around for a while, R&D has been there for a while in bits and pieces, only recently have we started seeing serious medical equipment coming out of the R&D centers of even larger multinational companies like the GE. If I look at Siemens, Siemens has been producing for a long while the X-ray systems. They have an R&D center, I would say a software development center in Bangalore, but that's pretty much it. And we now heard that they're going to be expanding their manufacturing capability in Goa for X-ray probably and other systems, other products. And then Philips has had an innovation campus in Bangalore where healthcare, apart from their other businesses, is also represented. So they do a lot of software development, maybe a little bit of product development. Recently, they announced setting up or investing in manufacturing facilities for medical imaging systems in Pune. So between these three, GE, Siemens, and Philips, I think about 80% of medical imaging is covered. So I just gave you a perspective of what the big guys are doing in India. If you flip and look at the other side about Indian manufacturers, Indian medtech companies in imaging, I think there are a whole lot of companies that produce basic X-ray systems. Today, many of them are graduated to digital X-ray systems. Some of them make ultrasound systems. Many of them make patient monitors, which is not exactly imaging, but then yes, they also do patient monitors, surgical C-arms and the like. But that's pretty much it. Most of them make. Most of them make for Indian markets. Fewer make in India for exports. And even fewer own technologies that can actually provide the differentiation, be it in terms of cost or be it in terms of features, such that we can compete on a global scale. I think that is the challenge. And that's where we are talking about create in India. And I'll just take a few minutes and give an example of what we are doing in Perfect Healthcare for you all to get an idea of what difference create in India can make to the country. In Perfect Healthcare, we are focused on a very related area to imaging. It's image-guided procedures. We are in the cancer care space. And within cancer care, we are in the image-guided cancer care for respiratory and digestive cancers. These are number one and number two killers within the cancer space. And I guess lung cancer is amongst the world's largest killer. Doesn't matter any other disease as well. It's probably amongst the number one or number two killers in the world. So we are talking about digestive and respiratory cancers, and a high percentage of patients in these categories have inoperable tumors. In India, China, and emerging societies, emerging markets such as in Africa, Latin America, they form about 70% of the cancers in these two categories. China, of course, beats everybody hollow. 40% of world's lung cancer is in China. 50% of world's liver cancer is in China. India is not that bad, but just that our sheer population, even a small percentage, would make for a huge number of patients. But India has another problem, cervical and oral cancer. I think we have the number one and number two probably positions in terms of mortality coming from these cancers, which is not the case in any other country. People do have cervical cancer and oral cancer. Not too many people die of these kind of cancers. So we are focused on the respiratory and digestive tract cancers, digestive cancers, where, as I said, the cancers are highly inoperable. A good proportion, maybe 70% and above, are inoperable cancers. So over the last couple of decades, this new form of cancer treatment called interventional oncology, which is a non-surgical, I would say a minimally invasive treatment. It's probably performed in conjunction with other forms of therapy like radiation therapy, chemotherapy, but it's non-surgical. To that extent, this is an outpatient procedure, probably done in about 4 hours' time, like a radiation. Patient can go back home. But unlike radiation or chemo, they have very little side effects. And as you know, liver cancers, it's probably very difficult to operate and resect and remove the tumor because of vascularity of the organ, and also because of the otherwise health of the organ by itself. It's probably not very easy to resect and remove the tumor. And radiation and chemotherapy are not appropriate forms of treatment, for example, in liver cancer. And interventional oncology, where they place a needle in a very minimally invasive manner, either under CT guidance or under open surgical procedures where they can place it. They don't remove the tumor after surgery, but then they place these needles and deliver energies to destroy the tumor. That's called tumor ablation. And Nishant was talking about skills. This is a clear area where across the world there is a skill problem. The physics of this treatment says that if you burn the tumor beyond a particular temperature, there is irreversible cell death, and that tumor is killed irreversibly. But then the techniques that are followed, the skills that are available to provide a good quality tumor ablation procedure is probably shot around the world, not just in India. India is probably worse than the rest of the world. But then that's a problem across the world. And that's where we come in. We help physicians to image the patient, obtain volumetric models of the tumor, so that the physician can estimate the tumor size, which is volume, and the shape, to determine what kind of energy is most appropriate to destroy this tumor. It could be in the lung, liver, kidney, pancreas, or the bone. Once you determine what kind of energy, how do you deliver, for how long do you deliver, how much energy to be delivered, how many instruments need to be placed, around the tumor such that the tumor is killed in its entirety. What is the sequence in which you need to place, because not always it's possible for a physician to destroy a full tumor with just one needle. So about 5 to 6 needles are typically placed if the tumor is larger, or if the tumor is placed in an awkward position, more electrodes are required to be placed around the tumor to destroy it. So this is called a multi-needle ablation. When there is a multi-needle ablation, the ablation could be distinct, as in you burn 20% of the needle, 20% of the tumor, and then go and burn the other 20%, and then go, which is a sequential ablation. Or you can place multiple electrodes and destroy the tumor at the same time. Now, all these is a part of the planning. Today, around the world, just the experts plan in their mind. There isn't a protocol with which this can be planned and executed. So using our system, once a physician figures the shape and size of the tumor, our planning system helps in determining the most appropriate treatment plan for the patient, very much like in radiation therapy. Once a plan is determined, our robotic system, which goes with the planning system, helps him in placing these needles very precisely. So 8th segment of the liver, achieving a 3 millimeter accuracy around the tumor so that the tumor can be ablated accurately, is not a joke, right? Even the most experienced experts. Last evening we had a call where University of Mannheim that uses our equipment, they're presenting a paper at the European Radiology Conference coming later in the month, and they were presenting the results of their study using our equipment and how they would have done in the past. So they compared results using our equipment with their historical data, and we were extremely pleased to see the kind of results that we have been able to achieve. Very, very accurate, and because of the accuracy, complications come down. Younger physicians, we are talking about democratization, like we talked about the 3Ds, 4Ds, democratization. How do you get younger physicians, people that are not 30 years experienced in interventional radiology, to be able to deliver the same quality of treatment to their patients in tier 1 and tier 2 cities, not just in the metro capitals? That's another area where our technology is extremely useful. Now, post the treatment, after these needles are placed, you deliver energies and hopefully destroy the tumor. Post the treatment, our software helps in verifying if the tumor was ablated completely or not. So it's a see, plan, treat, and verify solution enabled by robotics. That's a solution that we have created in Chennai, patented with the US PTO. I would have preferred that the India PTO offered this earlier than the US PTO. We applied for patents in 2006. We had to hear from the Indian Patent Office, understand they have a higher workload, training, whatever. But we have got our technology patented with the US. Papers have been published. About 15 papers have been published by top physicians from around the world. And these equipment are used in some of the best in the world, be it Memorial Sloan Kettering, where they published a study, in National Institute of Health in the US, University of Miami, Frankfurt, Regensburg in Germany, and I can name it, and in India. So our top hospitals like Tata Memorial, All India Institute of Medical Science, PJ Chandigarh, a whole lot. So we are very glad that about 100 users, more than half of our users are international. But we are also not that thrilled that we are not being able to take it beyond what we have in India. When India is an ocean, China is an ocean in terms of these diseases, we would like to grow it much bigger. But the point that I wanted to talk about today was we are recognized because we identified a requirement when we created these solutions. And it's unlikely that once you create a solution in a particular country, it's going to go away. If you just focus on manufacturing, the next wave, you'll take it from China to India, from India to Africa, and to wherever. But if you're starting to focus on creation of technologies in India, that's going to stay. And once that stays, downstream manufacturing would automatically come in. And that's our experience of being able to create solutions in India. And we have been able to win recognition worldwide. We today have performed about 8,000 procedures using our equipment in the last few years worldwide. Products are cleared by the US FDA, Japanese PMDA, European CE, Chinese FDA. Name any regulator in the world, they have cleared our product for use in those countries, and we are selling in most of these markets. And I guess that would give us a sustainable advantage because we have the patents, we have the technologies. Before somebody copies, we should be 5 steps ahead. How do we sustain ourselves when you create? You need to continue to invest in R&D, create the patents, and keep creating the difference between you and the next competitor. I think that's our experience, and I would think that's a sustainable model for doing something in India.
Thank you, Nandu. This is quite inspirational, actually. Whenever I think of manufacturing in India, to me, it sounds like blowing plastic. It doesn't go beyond that. But on hearing you, I do believe that creating in India is significantly beyond blowing plastic and so on and so forth. So, and that too, to be able to create products which are globally competitive. So thank you so much. And I also do hear that subtly you've tried to put across some issues that we have in our country, some challenges that we have. So well noted. Thank you so much for your conversation. With that, I move on to YS Prabhakar, again a dear friend and an ex-colleague. We were working in the same organization a while ago till YSP decided to move on. YSP is how we know him popularly. Till he decided to move on to Sutures India. And we share a little joke in our office. Ever since YSP actually moved to Sutures, Sutures, kind of started to be known differently. Investors started loving this organization. PE, VC funds started loving the organization. So on a serious note, consistent innovation and growth at Sutures finally caught the eye of the investors, as we say. Prior to joining Sutures, YSP was Director Biosciences with BD. He's also served as Director International Business at Danaher Corporation. YS, coming to you, the first question that we have, and that's something that I'd want to know publicly today, you didn't tell us one-to-one, is what happened? How did, in the last 2 years, Sutures get noticed by the investors for the consistent innovation that you do? And apart from that, I think there's one more piece that you and I have been talking about over the last few weeks, and that's about the skill set and capability development in India. So you may want to allude to that as well. With that, over to you. Thank you, YSP.
Thanks, Varun. Thanks, FICCI. To give an answer to Varun's first question, maybe I'll take you through who we are and what we have been doing over the last 23 years, and then come to answer that question. When the Make in India campaign started about 18 months ago, I think it was sweet music to our ears, because 18 years back is when we had started to make in India. So having started to make in India in a small way and started to compete with the giants of the industry for the wound closure, I think two things which were very, very pertinent to our promoters that time. I think it is also very, very relevant question which was asked yesterday in various panels here. The question of access, the question of affordability. I think on both counts, our company scored, because with frugal innovation, we went ahead, made the sutures. Sutures, as you all may be knowing, is used to close the wounds, predominantly after the surgeries, and varieties of needles and the suture materials. You have to bring the two together. That is where you need a passion. I think the third element is what Sutures India is actually bringing in now to the fore, and that is what is attracting the PEs and the VCs. Now, having done this for about 23 years, we have now risen to a strong number 2 position in India in the wound closure market. And based on the published data, we are 4th largest in the world in volume terms. One of the positives that I and Mala share here is that we are perhaps some of those rare gems here which have been exporting our products to 100 countries, not just making in India. I think there are not many parallels within the medical device industry or even the pharmaceutical industry. All of us are in awe of the Indian pharmaceutical industry, which have done so much for reverse engineering and going and taking market share in varieties of geographies. But I think barring 2 of our companies, not many have gone to 100 countries or more. We today manufacture in about 5 locations. Some of the beliefs and what we stand for, let me share with you. We employ about 1,200 people across these 5 locations spread in 3 states. So I should say, if you have a will to manufacture in India, many of the state governments and the other governments are very, very supportive, and we are the beneficiaries of that. So we manufacture today in the states of Karnataka, 3 plants, 1 plant in Kerala. You may wonder why, in spite of all the union and the other issues you may have heard of. We are manufacturing there very much. We are also in Andhra Pradesh, again in a SEZ area, mainly for the exports. So, in a nutshell, yes, legally and ethically, with the help of government, and in spite of certain challenges and hurdles, you can still make in India. And we are proof of that. I earlier said about 1,200 people working with us. More than 85% of that are women. Again, like what Dr. Usha was telling yesterday, we are very proud of that. Whoever comes as a visitor and sees my factory, that is something that hits them first. We have certain reasons and beliefs why we do that. Obviously, fixing a suture thread to a needle, it needs some dexterous fingers and hands, no doubt about it, what we call as swaging. Beyond that, we believe these women will take the money back home, they will save, they will educate the kids, and the families will run. And of course, we'll get more loyalty. And it has been proven because the skilling question which Varun was asking, several of these women, typically we put them through 7 days of rigorous skilling in the beginning, then about a month of supervised skilling, and then almost they're on their own. However, when it comes to the swaging under some microscopes and some specialized sutures, it is a higher order of the skill. There again, obviously, we put those women who have put in 3-4 years with us already. We do spend considerable amount of time on skilling and reskilling these people as we get into newer areas of sutures and wound closure materials. The third thing, how this frugal innovation has been possible is perhaps because of these reasons, like 99% of my products today are all manufactured by us. Very little of trading. It may be actually a great opportunity for us to get into that sooner. Nevertheless, I think that gives us considerable control on quality and cost efficiency. When I said it's frugal innovation, I'm not talking about jugaad. We have books written in India about jugaad, but I'm not talking about that. I'm talking about going for quality manufacturing. We are a company, we went in for CE pretty early in our days. Within a year of that, we went in for US FDA. There are very few companies in our contemporary sectors who have this kind of supports by global regulators. The other question I want to look at is, yes, having started to make in India, by the way, we come from Bangalore, the city known for innovation, city known for e-commerce, the unicorns, but we are pure play brick and mortar. Now the question is, having made in India, how do you really scale up? We are a 23-year-old company, mind you. So the question is the capital, the need for capital. That again, I allude to Varun's question. That is why the PEs and the VCs are required by us. They have been helpful to us over the last 4.5 years. But we have been investing in world-class manufacturing, and believe me when I say this, even my sterile gloves manufacturing is done under clean rooms. Not many companies we have visited do that. Every single suture that we bring out is subject to tug test at double the torque. Again, perhaps if you are manufacturing 50 million odd sutures a year, nobody would like to do that. The other question is, how do you really develop a thriving ecosystem around you? It has taken us at least 6-7 initial years to do that. But if we attend to that, again, you are better off. The last question is about the talent. I think this is something we are still trying to grapple with to an extent. As you go both in domestic, where we have a strength of about 360 people who go to the tier 2, tier 3 even hospitals and sell our sutures. So that is where the access is enhanced. But the question of talent at the right places, I think that is something very, very crucial. If you don't build that early in your life, that becomes a significant problem later on as you scale up. With the FDA opening up, I think in our medical devices sector, that's going to be a huge challenge from the MNCs and the other companies. So we ought to be better than the best in the world. To do that, we have to invest in quality control, quality assurance, and regulatory very early in our phase. Lastly, one point again, I want here a support or a solution. We are talking about making in India, but very soon, as more and more companies will start to make in India, a situation will come. How strong is that made in India tag? I'll give a small example. Last week, as the economic volatility was so big and hitting everybody hard, there was a joke circling around which said, oh, this is all due to China, but don't worry, it's made in China, so it won't last long. So we don't want that to happen to a made in India tag. So I would need FICCI, the whole industry and everybody's collaboration there, how do we improve the image of the Made in India tag? Thank you.
So YSP, thank you so much. I guess you guys are perfect examples of how you can enhance volumes if you get the cost positioning right. So all the very best to you and your company.